Otherwise, we may not do this live in that way. People should join now so that we can do this together. So, Jesus. Mhm. Hey, welcome to this live. Let me know if you can hear me. This is an unusual live. Please confirm that you can hear me. Okay, please let me know if audible. Thank you for joining the live. It's been a while, and we actually had this topic set for discussion about 2 weeks now, 2 weeks ago, for about 2 weeks now. Yes, it was for about 2 weeks now that we've been trying to get on this topic, talking about stroke. Mm. Okay, let me know if you can hear me clearly. I know there may be some noise around, but if you can hear me well, if I'm audible, then we can go on with this live. Okay, so it's good to be back. It's good to see everyone joining in. So many diseases, illnesses out there in the world. Okay, but we need to keep looking at these common conditions and diseases, and stroke is one major one. Stroke, and that's what we are talking about at this time. I don't know where you are joining from. You may like to let me know in the chat. Thank you everyone for joining in, and thank you for the like. All right, so we do everything health, wellness, and lifestyle with focus on chronic medical disorders. We look at reproductive health and, of course, mental health. And these are very critical areas of our health. Please let me know if you can still hear me despite the noise around. All right, so it's important to have knowledge. Information is powerful, but information without the right action steps will not actually the necessary results. So, if you're talking about prevention of stroke, we need to first of all know what exactly is stroke. Now it's becoming a common thing globally, whichever part of the world you are watching from. Someone somewhere this time is actually suffering from a stroke. In fact, some people, the first way by which they get to know that they have hypertension or high blood pressure or some other conditions, even diabetes, is from developing a stroke event. Okay, there's something we call transient ischemic attack. I'll talk about that. Some people call stroke, they use the terminology partial stroke, but in the real sense, uh, partial in the sense of occurring just within 24 hours and then resolving. We have people who experience that. And what should be done if an individual has such an experience? Okay, we talk about that. So stroke actually is a condition affecting the brain. The brain, whether in terms of the supply of oxygen or nutrients to the brain. So once blood supply is cut off, um, there is reduction in oxygen supply. An individual will have some symptoms, and those symptoms will depend on different factors. One, if they have had or they have an underlying condition which has actually led to developing a stroke. Conditions like hypertension, conditions like diabetes, high level of cholesterol, dyslipidemia, sickle cell anemia. There are some other conditions. People at risk also include those who are overweight or obese. And it's been found out that research has shown that there are more young people in their 30s, 40s, that are developing not just these chronic medical conditions, hypertension, diabetes, but also developing stroke, coming up down with stroke. It's usually an emergency. Usually, stroke is usually an emergency. So when that blood supply is cut off, when the oxygen supply is cut off, depending on the area that is affected, because the brain actually represents different parts, controls different parts of the body. There's a part for speech, there's a part for movement, uh, parts for vision. So if any of these parts is affected, this is what is responsible for the manifestation that the individual gets to have. All right. So if the part that controls speech is affected, for example, the individual may develop something like a slurred speech. Have you ever seen someone um, having slurred speech? There's so many other causes of slur speech, but developing a stroke is one common one. All right. So let me know if you can still hear me. I know there are some people on the call. Just let me know if I'm audible. I'll just give some introduction here, and then we will definitely continue in this discussion um, in a more quiet environment. All right. So the any individual that develops a stroke may manifest in with some symptoms or signs. Okay. If you know about the fast acronym, stand that F. The F actually stands for facial paresis, weakness, drooping of the face. It could be any of the sides of the face. Someone may notice that aspect of their face being affected. Okay, the A in fact stands for arm. Could be any parts of the limb actually. Could be the right limb if the left part of the brain is affected. So the movement, the individual experiences a weakness in that limb. Okay, and then speech is the next one in fast speech. slowness of speech. Okay, remember I've talked about facial paralysis, weakness of one side of the face, weakness of the arm or lower limb, weakness, sluggishness, sluggishness, slowness of speech. That's the other one. Then the T actually stands for time, that action steps must be taken for the individual to recover. Stroke has left many people uh, uh, devastated, loss, loss of their jobs, loss of money, has actually affected people mentally, and actually a major cause of reduction in quality of life. Okay, so that's where the place of uh, rehabilitation comes in when we are managing stroke. So have you ever seen someone experience or had a stroke? Do you know anyone who has had a stroke or who currently is experiencing uh, a stroke? Let me know in the chat. All right. So as I mentioned earlier, there are some causes of stroke. Some causes. Stroke in itself is not, in quotes, is not a diagnosis. It's a complication from some medical condition like hypertension, which is a major cause of stroke. So when there's increasing pressure, pressure above normal in the system, may also affect the blood vessels supplying the brain. Such an individual will may actually experience a a burst. I use that word, burst. That that is that pressure being enough to cause a burst in the vessel, leading to a bleeding into the brain is one thing that can happen during a stroke. And then for some other people, it's just plaque formation from high level of cholesterol levels high, and then deposition of plaques on the walls of the vessel may also lead, and formation of clots may also lead to blockage of blood supply oxygen to that particular part of the brain. And so when that happens, the individual does not receive enough supply to that part of the brain, and then the effect that the brain is supposed to manifest with does not take place. So that's one thing. So we have two types of stroke. Interestingly, we have three types. The third one is what I mentioned earlier. That's transient ischemic attack. That is a brief occurrence, experience of stroke. And when that happens, sometimes people are able to recover quickly. Maybe initial slowness of speech, they get to recover from weakness of the arm or legs. They're able to move within 24 hours. And that's a good one. So, what should such an individual do? Definitely, what should happen is that such an individual should present to the hospital. Very important for proper assessment. Now, the two types of stroke are the hemorrhagic type, hemorrhagic stroke, and then the ischemic stroke. Can also be used, the terminology thromboembolic stroke can also be used. That's when the clot formed is moved or passed from one part of the body and then to the brain. Now, it could be from the heart. So conditions of the heart, just like I said earlier, hypertension, hypertensive heart disease, conditions of the heart can actually cause an individual to develop a stroke. All right, so those are the two types. So when an individual bleeds to the brain, I'm just going to explain briefly how stroke comes about. Now, when an individual bleeds in the brain, so it now depends on the parts of the brain. The bleed, for some people, the bleeding may just be uh, mild, small volume bleed. If it is massive, it's worse usually. And the more the bleeding, the worse the prognosis. What I mean by prognosis is that the condition outcome is worse if the bleeding continues. Some people are able to recover with small bleeds, but for some other people, is the clot formation, clots, that's blood clogging together or plaque formation, blocking the flow of blood in the brain. Okay, so when that happens, the individual also experiences shortage in or even no supply at all to that part of the brain that actually needs oxygen and nutrients to function. Okay, so that's just a simple way to explain the different types of stroke. I've mentioned some of the symptoms. For some people, they just feel a sudden weakness, sudden tiredness, fatigue. For some people, a headache could be sudden headache, throbbing. For some people, they may not even have any symptom prior, and so many other symptoms that may be there. And why stroke? Why increasing rates of stroke at this time? I've talked about the studies that have shown that more young people are developing stroke now. Now that's because there are more people that are also developing uh, some chronic medical conditions, diagnosis of hypertension, whether they have had a family, positive family history, yes, of hypertension or positive family history of diabetes that they've not done anything about. Okay, such individuals are at risk of developing a stroke. So what else? Westernized diet. There's increasing openings. If you are in Nigeria, for example, increasing places where you can get westernized diet, the fries, all kind of processed foods, burgers, and the rest. Okay, occasionally one can indulge, but if you are already, prevention is actually better, and then it's even uh, not as costly as treatments or complication. All right. So, but there are things that you as an individual may be doing that can put you at risk. All right. Apart from hypertension, even if an individual has a positive family history of hypertension, there are things they can do to prevent developing hypertension. All right. So low salt diet, very important. Low salt diet. All right. And then proper management for people that have actually that have a diagnosis of hypertension. What should be done is that you should have a clear management plan from your doctor, and then this will help to limit the possibility of developing a complication like stroke. All right. So other conditions include diabetes. All right, because diabetes, high sugar level affects the integrity of the blood vessel, also putting the individual at risk of developing a stroke. People with sickle cell anemia also at risk. High level of cholesterol, I've mentioned that. So you need to be checking these things as an adult. Even if you are in your 30s, you are in your 40s, you should be checking your blood pressure regularly. Um, Once in a month is okay if you are not hypertensive. Um, but once you have a diagnosis, just follow your doctor's plan for monitoring your blood pressure. Thank you for the second like. Thank you, thank you, thank you, and thank you for joining in. All right, so just a brief on introducing this topic. We'll be discussing fully uh, later. So, but what else do I need to talk about? If you have any question regarding this topic, you can just drop in the chat. Thank you for the third like. Thank you for joining in. I believe you can hear me clearly. That I'm audible. I believe strongly. I'm audible. I believe I'm audible. How can I get more subscribers? Okay. Brizabali. Welcome, Brizabali. Thank you for showing up and coming on the live for engaging. Brizabali, are you subscribed to this channel? Are you subscribed to the channel? Are you a member of the community already? If not, You can join this wonderful health community. Brizabali saying I. Oh, okay. Brizabali is a member of the community. Thank you, Brizabali. Where are you watching from? Thank you. Where are you watching from? Let me know where you're watching from. Brizabali. Okay, I need to get this question clearly. How can how can I get more subscribe? You mean subscribers for yourself or your channel? Okay, you're in Zambia. Wow, great. Good to know. Thank you. How is Zambia today? And what time is it in Zambia? Yeah, in our zone, yeah, Africa. Right now it's 4:32 p.m. in Nigeria. I'm streaming live from Lagos. Okay, you mean subscribers, more subscribers for the channel. All right. Interestingly, there are a number of things I can share on that in my own experience. Being in my third year on YouTube, uploading videos, I have some little experience. All right. Okay, so talking about getting subscribers, it's important to get subscribers, of course, to get to uh, qualify for monetization. But beyond the subscribers, you need to be engaging. Your content must really be engaging. People need information, people need education, people need entertainment, people want to play games, people want to talk about different things, mental health, sexual health. People want to talk about relationships. There are things that interest people, cartoons. So I don't know what your content really is. So it all depends on. Okay, you're asking, so do I make money? Interesting. Okay, the channel is monetized and is growing. Okay, not fully monetized yet, but of course, already, if you check, you can see the dollar sign somewhere there. Okay, you can support the channel with that dollar sign. All right, so you can send a super chat. The channel is monetized, but full monetization where your adverts on your videos are being paid for. We are moving towards that for the channel. All right. So to talking about getting subscriber, really it boils down to the quality of your content and how engaging you can be. I'll just share one or two experiences with you. One of the things I discovered about my growth is the channel's growth is that initially I was going a bit solo in 2020. That was during I think around post lockdown, where there was nothing like joining communities and all. So that in a way did not give visibility. There are people that were actually supposed to benefit from my content earlier since 2020, but maybe because I wasn't engaging well enough with other content creators and even consumers on YouTube, I was just uploading and I did more of shorts then. Okay, and right now we've come to see that it's important to do more long videos than even short forms. All right, so if you're talking about growth, you need to build a community. Talking about getting subscribers is about building community. It's about giving value. It's about um, helping people to get what they need. If you provide value, if you provide substance, if you provide something that people need, definitely you're going to get subscribers. So maybe later I'll check your channel, but that's what I can say. I don't know what your focus is, but that's what I can say. No matter your niche, what I can say about uh, having subscribers. So it's not really by asking. It's good to ask for subscribers. I do sometimes. I do. I do. I do that too. Okay, but when people find out that what you are giving them is, yes, I can see you are one top fan now, Breeze Bali. Yes, I can see you as top fan on this live. Okay, Breeze Bali, I can see that you say, hope you can hear me now. Can see that you do music. You say you do music. That's cool. So it all depends on the type of music. When you focus on a particular type of music, there are people that may be interested in that type of music. Of course, when you do your music well, the quality, they will definitely subscribe. So you should also relate with other musicians, so to say. Um, if you can identify people in your niche who are also doing the same, sometimes when you even the individual may not even be a YouTuber. You just be bringing somebody up on your channel, doing content together. You just bring something new that can make more people to subscribe to your channel. That gives visibility. Do you go on live like I'm doing currently? These are other ways by which you can get more subscribers. So when you talk about subscribers, very good. The more subscribers you have, the more your chances of having views. But it doesn't really matter. One can have a few subscribers and still have plenty of views on videos, depending on the topic, depending on the content. Thank you for the fifth like. Thank you. Please let me know where you are watching from. Let me know where you are joining us from. We've been talking about stroke, but we just did a bit of introduction on this topic. And then Breeze Bali is asking question about uh, growth on YouTube. Yes. Now I can see that YouTube has actually activated fans feature for me, so I know who are those joining, who are those engaging more on my live. Okay, so it's becoming more interesting. All right, so I see that happen on other people's live when I join some people. So I'm not sure if it's available for everyone now, but I got that mail some days ago, and I can see that is already been effective. All right, so basically, I think I've been able to answer some parts of your question, and I hope to still share my YouTube experiences with time. Occasionally I come to share that sometimes our experiences actually differ. Our experiences are personal sometimes, but there are general rules. There are rules that apply. For example, if you are not creating content, for example, if I'm not showing up, if you are not showing up, YouTube is like having a shop, a store, and then you are not opening up your shop, you are not displaying your goods. It's like not uploading videos, you are not uh, posting in the community, you are not coming on live. You know, definitely you can't be talking about getting customers. You can't be talking about getting subscribers. So to get subscribers means that you are also showing up regularly and appreciating the people that are joining you, that are loyal to your channel. All right. So I believe I've been able to answer that question. So if you have any question on stroke, you can drop in the chat or ask by the time we come up in the next session, which may be later tonight, or I'll try to show up later tonight, which will be very good. I believe more people will be able to join in. Okay, so thank you for the fifth like. We'll talk more about stroke later, and thank you everyone who joined in. We've had about we're having like 30 minutes of this session. So we'll catch up later. Bye for now.